Joining us on Newsmakers on this Sunday, Congressman Tom Price, the chair of the Republican Policy Committee, Republican from Georgia. Thanks very much for being with us.
Thank you. Great to be with you.
And joining us with the questioning is Russell Berman, congressional reporter for the Hill newspaper, and Daniel Newhouser, who covers Capitol Hill for Roll Call. Thank you both for being with us. Congressman, let's begin with some of the news over the last couple of days. The announcement Friday by the White House on some changes, some immigration policy changes for those who came to the U.S. As children. Your thoughts?
Well, I think it's interesting that the president, who we all believe ought to be enforcing all the laws of the land, seems to think he can pick certain laws and enforce them and pick others and decide that he's not going to enforce them. I think that's what the American people find troubling. It's one of the reasons I think that the American people have lost faith and trust in this administration is because the administration seems to think that they don't have to deal with the laws that were passed by Congress and enforce them, when in fact that is the primary role of the executive branch.
Do you think there's a political motivation with the Hispanic vote key in the general election?
I'll let others draw that conclusion, but I know that many do believe that.
And should he have gone through Congress?
Well, the last time I read the Constitution, it's the Congress that passes the laws and the administration, the executive branch, that enforces them. So why the president seems to believe that he can pick and choose the laws that he enforces is beyond me.
Let's turn to Russell Berman of the Hill newspaper.
Congressman, you're a member of the Doctors Caucus, and of course the Supreme Court is expected to rule in the next couple of weeks on the health care law. First of all, everybody's making predictions. What is your prediction for how they're going to rule?
Well, I'm not a court watcher, and I'm a physician, not a lawyer, so it's a little tough. But I think that if you look at the questions that were asked and the tone during the oral arguments before the Supreme Court, my suspicion is that the court will throw out the individual mandate. This is a town that tends to like to split the baby or to divide issues. My sense is that they will find that the individual mandate is unconstitutional because, as Justice Kennedy said, if it is allowed to go forward, then it would fundamentally, his word, not mine, fundamentally change the relationship between the state and the citizen. And I don't think this court is going to allow it to go there.
Now, if that happens, clearly the House Republicans want to repeal the entire law. But if they either strike it down entirely or only eliminate the individual mandate and some reforms, what's the response going to be? What can we see in the next few months? Because clearly Democrats are going to put a lot of pressure on you guys to act to protect people under 26 from losing their insurance, children with pre-existing conditions, seniors who will fall back into the donut hole.
Sure.
What can we see in the next few months from the House Republicans?
Well, I think it's important to appreciate that the House Republicans, the House has already voted to repeal the entire health care bill. And we did so because we believe it to be an affront to the practice of medicine, but also violative of the principles of health care that all of us hold dear, whether it's affordability or accessibility or quality or patient choices. All of those things are violated by this law. So we believe that the whole thing needs to be repealed, depending on what the court does. And it's a small clause, but everything that occurs after the court depends on what they do. I think they could rule it constitutional, the whole law constitutional. They could rule the whole thing unconstitutional, or they could rule part of it unconstitutional, and maybe some things that attach to that. Depending on what they do, then that dictates what congressional response will be.
But do you see any response in the immediate aftermath, or is this something where we've heard that the election is going to decide a lot of things, and is health care going to be one of them, so that we're just not going to be able to see anything until November, regardless of what happens?
Well, we have no desire to make the same mistake that the Democrats made, and that is to pass a 2,700-page bill that many of them didn't read, and to pass it without having input from everybody. So we want a transparent, accountable process and an open process for not just legislators, but for the American people. We believe that the kinds of challenges that we have in health care, the status quo is unacceptable, and the kinds of challenges that we have right now can be solved without putting Washington in charge. A lot of ideas out there, a lot of unity on our side, again, to repeal the president's law and to make certain that we go forward in a positive way, in what I call a patient-centered way, which means that patients and families and doctors are making medical decisions, not Washington.
Let me turn to Dan Newhouser of the Hill.
Sure.
Of Roll Call.
Yeah, sure. Of course, the Majority Whip, Kevin McCarthy, has been holding meetings with members to try to gauge their support for some of these, bringing some of these popular provisions to the floor. And you've been in some of those meetings. What sense do you get that there's appetite among your conference to vote again on some of these things that were in Obama's health care law?
Well, again, whatever the court does will dictate what kind of response. My sense is that there won't be significant disruption in the real world immediately, almost regardless of what the court does. A lot of the things that have been put in place are contracts, so they're contracts between an employer and an insurance company, or an employee and an insurance company. And that contract, as I understand it, the experts that we've talked to, stands regardless of what the court does. So what we will do is go through a rational, methodical process to determine what disruption there is out there for patients, for citizens across this land, and then depending on what disruption is out there, then determine the best course of action. But again, it's important for the American people to appreciate that we believe the whole thing ought to be repealed. We believe that there are wonderful solutions to fix the challenges in health care that don't require putting Washington in charge, whether it's getting folks covered or solving the insurance challenges of portability and pre-existing, or saving hundreds of billions of dollars. We can do all of those things without putting the politicians and bureaucrats here in Washington in charge.
Without a mandate, how do you pay for all those things?
Well, the savings, there's so much waste in healthcare right now. Hundreds of billions of dollars. Gallup estimates that 1 out of every 4 healthcare dollars, 25% or $600 billion of money wasted in this country on what's called the practice of defensive medicine, which are the kinds of things that I did and that doctors across this land do to make certain that if they're ever called into a court of law, that they can look the judge and the jury in the eye honestly and say, look, I don't know what you expected me to do because I did everything, and then show them everything that they did. In fact, everything isn't necessary to either diagnose the patient or to treat the patient. $600 billion, and even if they're off by a factor of 50%, that's $300 billion, which is still a lot of money even here in Washington. So what we need is robust lawsuit abuse reform. There are many bills that can address that. We have authored a bill that we believe would get us on the right path towards saving the kinds of money. It's not that we don't have enough money. It's that we're spending it in the wrong way.
But as you know, you're a doctor, and one of the fundamental problems you have is that many people use emergency rooms as their primary care physician. So how do you deal with those people who don't have insurance, need medical attention, hospitals have to absorb the cost and pass it on to others who have insurance?
A great question. First, you got to get folks covered. You can't have 30 to 50 million folks out there walking around without health coverage.
Which is what the President's bill does.
Well, what it does is gives people a coverage that the government wants, not that the patient wants. If you don't want what the government says you got to have, you still got to have what the government wants you to have because they're requiring it. That's the problem with the mandate. That's the unconstitutional aspect of it.
So how do you enforce the coverage?
We believe that if you make it financially feasible and attractive and foolish for anybody not to be covered, so that when people are doing their budgets, people actually do budgets. I know the Senate doesn't do budgets, but people do budgets. When they do their budget and they look and they say, oh my goodness, look, it makes more sense for us financially to be covered than not. And then they'll purchase the coverage that's right for them and for their family. And from the emergency room question, it's important that we have appropriate lawsuit abuse reform so that when an individual comes to the emergency room without a problem that's an emergency, if they're triaged appropriately, then those individuals ought to be able to be referred to their physician the next day. The fact of the matter now is that the emergency rooms and the physicians in emergency rooms are required to see them regardless of the emergency status of that patient. So there's some wonderful positive changes that actually make the system more responsive to people and make it so that those caring for the patients across this land are able to do so in a better way.
So you talked about incentivizing healthcare coverage. The President has reportedly been telling donors that if the mandate is struck down, tax incentives might be a way to go to get people covered. That's something that's been in a bill that you've introduced. Yeah. Do you see any coming together there between House Republicans and the President on something like that if the mandate is indeed struck down?
Well, I can't tell you how often the President has actually said the right thing and then done the wrong thing, or done what he didn't say he was going to do. So I haven't heard that from the President. If the President's actually willing to look at positive patient-centered reform, which again is putting patients and families and doctors in charge, not Washington, then we're ready. We've passed all sorts of legislation that the President has refused to attend to, has refused to address, has refused to insist that the Senate actually take up. And not just in the area of health care, but in the area of jobs and the economy as well.
Congressman, from a political standpoint, you've obviously mentioned a lot of ideas for the replace aspect of House Republicans. They want to repeal and replace the health care law. But it's been a year and a half, and House Republicans have not brought any real bills to replace the health care law. Is that going to be a political liability? I mean, clearly Democrats are going to say, well, where's your answer? And so far there hasn't really been one.
Well, there are all sorts of bills introduced, as you well know, to address the challenges in health care. The fact of the matter is that we have passed legislation. First, we passed the repeal of the President's health care law. It sits over in the Senate. We passed the 1099 reform, which the Senate actually took up and the President signed. Recently, we passed a repeal of the medical device tax, which is a remarkably onerous tax that actually decreases the ability of companies out there to innovate and to create the kind of high-quality health care or continue the kind of high-quality health care that we have. We call on the Senate to take that bill up and urge the President to support it instead of threaten a veto, which he has done. So there are wonderful things that we have done and can be done. But until the court rules, nobody knows what is necessary to be done. And with a Senate that has been recalcitrant and not willing to assist in positive ways, I'm not sure that passing a piece of legislation at this point is what needs to be done.
Another reference to the Senate, which gets to really the bigger issue of the inability of Democrats, Republicans, the House and the Senate to really come together on some of these big issues. Why is it so difficult for Republicans and Democrats to work on budget issues, on fiscal issues in this Congress?
It's a great question. I wish that you'd ask it to Senator Reid.
But he may say the Republicans are at fault. So look at it from your standpoint, and look at it from the standpoint of the American people who say Washington is dysfunctional.
And it seems dysfunctional, and I share their frustration. The fact of the matter is that the House has passed at least 30 pieces of legislation to deal with job growth, the economy, getting the economy growing again. We've passed a budget each of the 2 years that we've been in charge. The Senate hasn't passed a budget in over 3 years now. It's hard for somebody like Senator Reid, to stand up and say that the problem is in the other body, when in fact his body doesn't act at all. His chamber doesn't act at all. The American people are so frustrated when they look to Washington, but then when you drill down a little bit and they see that the Senate hasn't passed a budget in over 3 years, they say, oh, how can they get away with that? They aren't even doing their job. So it's all about leadership. It's all about leadership. And I call again on Senator Reid to take up the bills. If you don't agree with our bills, that's fine. Pass something that you do agree with, and then let's get to conference the way it's supposed to work and move forward and solve these challenges.
Will it be different after the election, regardless of who wins the presidency?
I think so. I think that the American people are going to speak loudly. I think they're going to say, as they did in 2010, look, we don't believe in an overreaching, ever-expanding central government from Washington telling us what to do in our daily lives. And they will send people to Washington that will reflect that perspective. So I think that it will be different. I think you're going to see wholesale change, and I think that Governor Romney is poised to be a wonderful president.
Dan Newhouser of Roll Call.
Sure. Speaking of after the election, we've got quite a lot on our plate. The sequester, payroll tax cut, debt ceiling, the Bush-era tax cuts. What's your prediction on how all of these things get dealt with after November?
Well, in the House, we hope to deal with some of them before the election because we think that the American people are speaking loudly. When I talk to folks in business, small and large businesses, about why they can't create jobs or why they don't create jobs, one of the big issues is uncertainty. There's huge uncertainty out there about what the effects of the health care law are going to be, what their energy policy, what the taxes are going to be as it relates to energy, what their taxes are going to be. And all of these things expiring at the end of the year, we believe in the House Republicans believe it's important to address those sooner rather than later. So what I think we will do is to pass a piece of legislation that will continue the current tax policy for at least a year, and send that to the Senate. Let the Senate act. Now, if the Senate doesn't agree with that, that's fine. We would call on them to act and not just to put it in a bottom drawer. The American people want to know that Washington is going to get down to the heavy lifting, the hard work that needs to be done to get this economy growing again.
On the tax issues, we keep coming back to this. The Democrats make a lot of Grover Norquist, and we saw recently Jeb Bush distancing himself and saying that the party should distance itself from the pledge against any tax increases from Grover Norquist. Do you see any movement in the Republican Party on the issues of whether you call it taxes or revenues? And because that's going to play a big role at the end of the year, are the Republicans now willing to consider increased revenues as part of a broader deal?
Well, we're not interested, and I don't think the American people are interested in increasing taxes on the American people or American businesses to chase ever-increasing spending. That doesn't make any sense at all. The fact of the matter is the tax policy and the spending policy in this town are driving this country to bankruptcy. We've got a $15 trillion debt right now. This president has amassed $1 trillion plus deficits each of the last 4 years. And if you look at his plan for America, it continues to increase the debt. You can't continue that. American people know you can't continue that. So we passed a budget that twice now, once last year and again this year, that would get us on a path to balancing the budget and paying off our debt. And we did so by closing the loopholes. Many of the loopholes that have been discussed, we believe, are appropriate to end by bringing down the rates of taxes, by broadening the base so that you can increase revenue and increase growth out there in the economy. That's the way you get this economy rolling again.
But you believe that has to be revenue neutral, cannot add any incoming revenue according to the way that the Congressional Budget Office does these projections?
I'm unaware of any reasonable economist who will tell you that what Washington has too little of is money. What we have too much of in Washington is spending. And there are a lot of things that the federal government is doing from a spending standpoint that it just needs to stop. And the American people know this. We borrow 40+ cents on every dollar that we spend. You can't continue that. Families can't do that. Businesses can't do that. Governments can't do that for long.
And yet when your party had control of the House and the White House, passing a Medicare plan and also the 2 wars that the president talked about last week, saying that there was no way to pay for Iraq, Afghanistan, and Medicare Part D. Was that a mistake?
Well, I wasn't here when those decisions were made. However,
was it a mistake for the party?
What I will tell you is that prior to the Democrats taking control of the House and the Senate in the 06 time frame, and prior to this president coming into office, the deficits that we were running in this country were about $150 billion, not $1.5 trillion. So the fact of the matter is the economy was growing and it was expanding, and that the revenue that the federal government had and the path that we were getting on to a balanced budget was clear. So again, the last thing that the American people want us to do is to increase taxes to chase ever-increasing spending. That just doesn't make any sense at all.
Harry Reid, the Senate Majority Leader, announced on Friday that he'll be holding a vote on a small business jobs bill that would try to incentivize hiring with tax incentives. Is that something that you think could be taken up in the House by the Republicans there?
Well, possibly, but I would urge Senator Reid to go back and look at what actually creates jobs. It's not tax incentives. It's decreasing onerous regulations from the federal government. It's tax decreases so that businesses can drive more of their money back into expanding the business. It's certainty in the marketplace so that the job creators out there, small and large businesses, know that the federal government isn't going to come in and change the rules in the middle of the game. There's so much that this government can do to get out of the way of business creating jobs. So whether or not another tax incentive is needed, it's certainly something that we can discuss. However, again, I would remind folks that the House has passed 30 pieces of legislation plus that would in fact create jobs out there in the economy, and they sit on Harry Reid's desk. Let's take up one of those.
Why would taxes? I'm sorry. Why would tax incentives be the right solution for healthcare, possibly, but the wrong solution for a small business jobs bill?
I don't think I said it was the wrong. I said it's something that we ought to discuss. But again, there are 30 plus pieces of legislation that the Senate could easily take up that would expand the economy and create jobs. But I welcome Senate action on this. They've been recalcitrant in not acting. So let's have the Senate pass a bill. The House has passed multiple pieces of legislation. Then let's get together and hammer out any differences and move legislation forward.
Russell Berman of The Hill.
We've got a couple more deadlines coming up at the end of June. The student loan rates are going to double if there's no congressional agreement. And the highway bill funding expires, and there's been a conference committee that negotiations have apparently broken down or are not going that well at the moment. What is your level of confidence that there is going to be an agreement on these two issues before the end of June? And more broadly, do you have confidence that there can be any agreements between now and the election, or are we just inexorably into campaign season?
Well, I hope not. I hope there can be agreements. But it's important to appreciate that the president has a narrative out there that Congress can't get anything done, and that's why he needs to be reelected. So if you think about it, if Congress gets something done, which requires the president to help, then it harms his narrative. So what we see is a president that seems to be urging a Democratic Senate not to be positive and not to be productive in these negotiations as we move forward. Whether it's on the highway bill, whether it's on student loans and the interest rates for student loans, whether it's on taxes, whether it's on energy policy, whether it's on health care policy, the whole array of issues, we see a Senate that refuses to act. My sense is that the president is not encouraging Senator Reid to actually be productive, that they're just waiting until the election occurs.
Sure. So you recently attended a Neil Diamond concert. How was that?
Indeed.
This was a fundraiser for your leadership PAC. This is something that members generally do when they're seeking a higher position within leadership. Are you seeking a higher position? Perhaps as some have speculated, a Republican conference chairman?
Well, I currently chair the policy committee, and I've had it's a great privilege to be able to do that. We're looking at all sorts of options that are out there, and we'll see what the future brings. Right now, I'm concentrating on making certain that we retain a majority in the House of Representatives, that we energize people across this country so that the Republicans are able to take control of the United States Senate, so that we have a working relationship with the other chamber. And I'm very, very hopeful that Governor Romney will be elected president so that we can work positively to solve the challenges before us.
Please continue.
So, yeah, if you did take up that run, that would be probably pit you against Kathy McMorris Rodgers for the conference chairmanship. Do you think there's anything that qualifies you above her to hold that position, or?
Again, these races aren't run in the press. These are races that are within the conference, the Republican conference itself. My number one job right now is to make certain that I chair the policy committee in as positive and productive a way as possible. Make certain that the House remains in Republican majority, that the Senate moves in the Republican direction, and that Governor Romney is elected president of the United States so that we can move forward positively.
We have 3 or 4 minutes left. Let me ask this 2 ways. If the president is reelected, or if Mitt Romney is elected president, what advice would you give Democratic and Republican leaders to get to the core issues, to have a conversation, to be able to get beyond the politics that we've seen over the last couple of years, to get some things done?
I think it's just that you've got to sit down and work. You've got to work together. The challenges that we face as a nation are huge, whether it's the economy, whether it's taxes, whether it's energy policy, whether it's health care policy, whether it's trade policy. The challenges are huge, and the American people expect us to do our job. And that's why there's so much frustration, I believe, across the land, because they look to Washington and they don't see the job getting done. If you look at the ledger, however, the House Republicans have passed multiple pieces of legislation to address every single one of those issues. And the fact of the matter is that the Senate refuses to act. So when I call it the do-nothing Senate. If the president is going to run against Congress, he's going to have to run against the do-nothing Senate, which again is why I call on the president to call Harry Reid and tell him to get to work. Let's pass some of these bills.
What about the relationship between the president and the speaker? Are they not talking to each other?
I don't know anything about the relationship between the president and the speaker, other than I think it's as productive as it ever has been.
Now, talking about the election, both candidates have described it as stark contrast, competing visions. Voters need to choose. Do you see it as a mandate election if President Obama wins, given that the stakes have been laid out this way? Is that a mandate from the voters for his policies for higher taxes, and vice versa with Governor Romney?
Well, I don't think President Obama is going to win, because I think the American people recognize that what they have seen over the last 4 years is an ever-expansive, far-reaching, overbearing central government. And I believe it is that stark. We have a choice of 2 futures. It's a future that says that Washington knows best, that it can tell you how to run your daily life down to very minute details, or it's a future that embraces the wonderful spirit and entrepreneurship and idealism of America. The things that made us the greatest nation in the history of the world. That's how stark it is, I believe, and that's what I believe the American people understand, and that's why I believe they're going to elect Governor Romney president.
But how can voters have hope that the election will lead to change if the elected officials aren't willing to sort of agree on the terms of the election, agree to say, if President Obama wins, that's higher taxes. If Governor Romney wins, that's repeal of the health care law, that's lower taxes, and that's his program? Well,
elections are about contrast. And I think there will be a very clear contrast. So I believe that when the American people speak in November, that they will embrace the kind of policies and bills that the Republicans have put forward to decrease taxes, to decrease the overreaching regulatory oppression from the federal government, to solve the health care challenges in a positive way that put patients and families and doctors in charge, to embrace an energy policy that in fact is all of the above, that allows us to become self-sufficient as a nation as it relates to energy. When they do that, then I'll be happy to meet with you and say, it's exactly as I said, that the American people understood that the contrast was real and that they embraced American exceptionalism.
So a mandate if Romney wins, but maybe not if Obama wins.
Well, I'm convinced that he's going to win, so I think the American people will be speaking loudly, yes.
Last question.
Instead of contrast, let's turn to compromise for a second. There's been this elusive grand bargain that's been out there. They've been trying all year to reach it. What scenario electorally do you think would be the best for reaching a grand bargain to deal with the deficit, where the parties come together?
Well, you got to recognize that the consequences of not getting our fiscal house in order are grave for the country. And what we have done is put forward budgets in each of the last 2 years that actually get us on a path to balance and paying off the debt. And what that requires is that you've got to address the issues of Medicare, Medicaid, and Social Security. We believe that those three programs ought to be strengthened and secured and saved, as opposed to abandoned in the way that the President's party, I believe, has done in so many ways. And so if you solve those challenges from a financial standpoint, then you actually get on that path to balancing the budget. That's the positive nature.
Mitt Romney about to select his running mate. I'm not going to ask you who you think that would be, but what type of person does he need? What should the Republicans be looking for?
Well, clearly somebody who, if events were to dictate, could step in and become the president immediately, have the experience and the knowledge base and the confidence of the country to be president. I believe it must be somebody who has the principles, embraces the principles that made us great as a nation, understands the wonderful exceptionalism that this country is, that allows for individuals to dream big dreams and realize those dreams by putting their hard work into effect. Needs to be somebody, I think, who has the ability to listen and to work with individuals across the political spectrum. There are all sorts of folks out there who fit that bill.
Congressman Tom Price, Republican of Georgia, chair of the Republican Policy Committee. Thanks for joining us here on C-SPAN.
Thanks so much.